More about the impact of the Delta variant on outdoor event spaces. I'm joined by Will Humble. He's the Executive Director of the Arizona Public Heralth Association. Welcome to the show.
Thank you.
So as we look at some of these images of these large crowds, should these large events, even outdoor, be happening at all, given that the Delta variant surge and the recent slowdown in vaccinations?
Well, the outdoor events are much safer than indoor events, no matter what the vaccination status of the attendees are. In fact, there's good evidence that it's at least 10 times safer than indoor events just because of the additional ventilation. But one of the unique things that we're seeing in the U.S. is some of these summer festivals, the motorcycle one in Sturgis, South Carolina, for example, are the participants in those events are almost all unvaccinated. And so you combine the fact that there are so many unvaccinated participants in the outdoor spaces, that's a pretty high risk. But a lot of the venues that you see, the bars and the nightclubs, for example, are indoor. So a lot of these are actually pretty dangerous situations.
And you mentioned Sturgis then. So what happened last year, and do we expect anything different this year?
Well, last year it went like there was no pandemic at all. I mean, it's a motorcycle rally that happens in South Dakota every summer, and people show up there from all over the country. But they have a certain mindset. The people that participate in that kind of an event are very independent-minded, the very type of people who have not been accepting the vaccine here in the U.S. And so that's the situation that you have last year and this year. I mean, I don't even know that it would really be that. It may even be actually worse this summer because of the Delta variant, even if some of the participants have been vaccinated.
And we are seeing for some venues safety precautions, including showing a proof of vaccination or a negative COVID-19 test taken within a few days of an event. Those were used for some of the bigger summer events, including Lollapalooza. But how consistent are some of these venues when it comes to their safety efforts?
Oh, they're totally inconsistent, and it's completely dependent on what state you're talking about. So, for example, what you would see in New York City or the state of New York is completely different from what you would see in a state like South Dakota. I mean, sometimes it's hard to imagine that they're even in the same country. The policies are so different, and it's part of the nature of the United States Republic, where you've got states, governors really have a lot more control than you realize and set the policies for those states with their state legislatures. And the legislatures in a place like South Dakota are very laissez-faire, like let people do whatever they want. And it results in the kinds of policies that allow what's going to happen again this summer in Sturgis. But you do see much safer events in some of the states that are run by more Democratic governors.
So then are local health officials going far enough then with their prevention efforts or their education efforts and outreach?
Well, it depends on the state. Again, it depends on the state. And so you see states like Arizona, Texas, Florida, Louisiana, the very states that we talked about a few minutes ago that have the hospital surges in place. Those are the states that tend to have the governors and the health directors that basically aren't doing any mitigation. In fact, in our state, in Arizona, our governor has forbidden our school system, which is just starting back in for the fall. School districts cannot require masks. That's how far our governor has gone. It's the same in Texas. It's the same in Florida. It's still the same in Arkansas, although he wants to go back on his previous ban. So you've got governors that are making decisions that are actively making this worse, and their health directors who report to these governors are just rubber stamping everything that the governors do and say.
So then in terms of solutions, would something like contact tracing at this stage of the game, would that even matter? Is it even possible then with a lot of this political pushback?
That's a great point, because contact tracing is valuable once you get to a manageable number of cases per day. Once you start blowing the doors off, and like what we're seeing in Texas, Florida, what we're about to see in Arizona, like what we are seeing in Louisiana, Arkansas, and up into Missouri, is states that have let it get completely out of control. And when that happens, contact tracing is really not an effective tool anymore. There's just too much community spread. It's a much more valuable tool once you've got things under control. Like, for example, after you shut down and have a lockdown of bars, restaurants, and nightclubs, you can maintain that level of transmission using lower level of transmission using contact tracing. But once it gets out of control, you can't. So that's a good point.